Victoria has recorded 19 more coronavirus deaths in the past 24 hours and 322 new cases. It follows revelations from a whistleblower nurse who worked in the state's troubled hotel quarantine scheme that the health department appeared more concerned with appeasing guests than infection control. Reporter Stephanie Ferrier joins us now from Melbourne. Steph, I don't want to say good morning, so it's just so sad to hear, isn't it, that these numbers just keep climbing in terms of people who are dying in Victoria on a daily basis from coronavirus.
Hi Joe, yes, it's just a devastating toll, isn't it? 19 more deaths here in Victoria as a result of this pandemic. And, you know, that's now a deadliest day. That's breaking another record with 17 yesterday. So, you know, that's 36 people who've lost their lives in the past 2 days alone. And you can just imagine the heartbreak that so many families here in Victoria are suffering at this stage with these sort of numbers just continuing to climb. So it's really awful news, that latest toll. However, the one glimmer of hope, I guess, is that our numbers consistently are going down. As you mentioned, it's 322 new cases detected, and that's another drop from yesterday, which was 394. So we have seen that consistent decreasing in numbers since last Wednesday's peak when we had those 725 new cases. So we heard from Dr. Nick Coatsworth, who's the country's Deputy Chief Medical Officer, who says that, you know, obviously we're not looking at this just on a day-by-day basis, but it is something that we should be really happy about when we see those numbers at least consistently head south.
What is clear is that the stage 3 restrictions and now the stage 4 restrictions have led to a plateau, and there's every expectation that the stage 4 restrictions have restricted movement enough that the basic reproductive number is going to fall substantially below 1, and we're going to start to see those numbers come down. But what we can't have is the disappointment or that roller coaster ride of them going from 390 to 450 and up and down again. So it's important to wait for the trend to emerge, but we do have some confidence in the coming days to week we'll see those numbers come down.
Dr. Nick Coatsworth there, and of course he was saying that Victorians also like to see a bit of reward for their efforts, because of course this is a full week now since we had the start of these stage 4 lockdowns here. We've had stage 3 before that, as he mentioned, and for 2.5 weeks we've all been wearing masks. Of course I'm not right at the moment while I'm live on air, so that hearing impaired people can understand exactly what I'm saying, but this mask goes on as soon as the live cross is over. So we do have these sorts of efforts that are constantly going on, so at least we are starting to see some sort of pushback in those numbers as a result of that. Now, the numbers that we just received on the 322 were also tweeted by the VicGov DHHS Twitter account, and they're going to start doing that as of today onwards, just to remove any of that speculation, and we're expecting potentially to hear more details about the numbers when the Premier fronts the media, probably around 11 o'clock this morning.
And Steph, officials there in Victoria have conceded that this second wave, as it's being described, can probably be traced back to breaches in hotel quarantine. A nurse who worked in the hotel quarantine setup has spoken to the ABC. What she had to say.
Yes, this nurse, this whistleblower who doesn't want to be named, worked very regular shifts between April and June at least half a dozen of these quarantine hotels. And she says that staff from the Department of Health and Human Services appeared to be more concerned about fulfilling guest needs and demands rather than infection control. And she says that was as a result of them being rattled over a suspected suicide of a guest who was in hotel quarantine in April, just 2 weeks into the start of this program. Now, she says that instead of making sure that these people were as isolated as much as possible, instead these guests were allowed extra fresh air and cigarette breaks if they complained loudly enough. So unfortunately, she says that some of these guests took advantage of that more relaxed attitude, that they actually were communicating over social media and Facebook to give tips to each other about how they could maximise their outside time. And that means that she says that she believes that this increased interaction between guests and staff that was really unnecessary did really increase the risk of COVID-19 getting out of those hotels and into the broader community. Now, the Department of Health says that it wouldn't be appropriate to comment on these latest allegations, given that we still have the upcoming independent inquiry into the hotel quarantine issue, which of course has been delayed as a result of these stage 4 lockdowns. The evidence won't start to be taken until August the 17th.
Okay, Steph Ferrier reporting there from Melbourne.